So as always, we start with the case updates, and today we are reporting on 3 periods. From Friday to Saturday, we had 100 cases of COVID-19 in British Columbia, Saturday to Sunday, 88 cases, and Sunday to today, 48 cases, for a total of 236 new cases or diagnoses of COVID-19 in BC, bringing the total for British Columbia since the beginning of the pandemic to 4,594 cases. The distribution of these cases by health authority are 1,419 cases in Vancouver Coastal Health, 2,425 cases in the Fraser Health Authority, 154 cases on Vancouver Island, 405 in the Interior Health Authority, and 117 in Northern Health Authority. 74 cases were from outside of Canada. Currently, in British Columbia, we have 743 active cases of COVID-19, of whom 4 are in hospital today, and 3 are in critical care. 2,286 people in British Columbia are currently under active public health monitoring. We are set to report 2 new deaths, both in Fraser Health, bringing the total to 198 deaths in British Columbia since the beginning of the pandemic. Our sincere condolences to everyone who's lost a friend or loved one to COVID-19. As of today, there are 3,653 people in British Columbia who have fully recovered from COVID-19. We also are reporting some new outbreaks in healthcare facilities. There are 2 new outbreaks in the Chorney Alzheimer's Centre in the Fraser Health Region and the Arbutus Care Centre in the Vancouver Coastal Health Region, bringing the total to 10 active outbreaks in the healthcare system. There are 9 in long-term care facilities and assisted living and 1 in acute care. In total in British Columbia, there have been 690 cases in long-term care facilities, assisted living and acute care, 415 of whom were residents, and 275 were staff. At this time, the outbreak at the Joseph and Rosalie Siegel Family Health Centre has been declared over. There are no new community outbreaks to report today, but health authorities do continue to issue community exposure alerts for a number of locations and flights coming in and out of British Columbia. This weekend, Northern Health has issued a community exposure alert for anyone who may have attended the It Is Time Canada event in Deadwood, Alberta from July 30th to August the 2nd. If you attended the event, you're asked to self-isolate for 14 days and monitor for symptoms. Seek care should you develop any of those symptoms. And wherever you live in British Columbia, please check regularly the health authority websites and follow guidance of public health teams should you have been in a place where there is a public exposure of COVID-19 reported. So what do all these numbers mean for British Columbia today? We do have an increasing number of cases of COVID-19 in British Columbia, and the majority of new infections in BC at this time are among young adults. This tells us that we have done, to date, a relatively good job of protecting the most vulnerable. But we are also reporting some new outbreaks in long-term care facilities, and that's a really important reminder for us all that the risk to vulnerable citizens of British Columbia remains. Now, what does this all mean for us today? What have we learned about COVID-19 since the start of the pandemic, and what is it that we need to do about it? Well, what we do know is that COVID-19, especially among young and healthy individuals, not always, but can be and often is, a relatively mild infection. And in fact, the disease can spread with very mild symptoms or before symptoms appear at all. This is, again, particularly the case for young adults who make up the majority of cases in BC today. This actually makes things quite challenging, and that's because some people may not even realize that they have COVID-19 and they can inadvertently spread it to others, to friends, to colleagues, to family members, and other vulnerable people in their circle, in their community, and even in their workplace. You may look at the numbers of people in hospital and ICU today and feel that things are looking good, and And in fact, we should be pleased to see that we are able to, or have been able to, protect those most vulnerable. But it is also important to remember that there are hundreds of people with COVID-19 and hundreds more are self-isolating. And it is very important to remember that for our elders and those with underlying health conditions, the potential for severe disease remains. Again, this may not apply to you, but you could easily spread the virus to someone who is vulnerable through your work or when spending time with friends and family. Today, we have a number of active outbreaks and community clusters, and our public health teams on the ground are very proactively managing and following up these outbreaks, notifying close contacts, and doing all they can to break the chain of infection. But for us to be successful, we actually need everybody to help. With the number of people in BC today, we are at a time when we all need to be particularly alert to how we are feeling. You may feel well enough to see friends and go into work, but rather today, the bar for staying home and staying away from gathering needs to be very, very low. How low? Likely much lower than what you are used to. With any symptom at all, please stay at home. Please do not go into gatherings. And that makes you a COVID-19 champion who chooses to stay at home and stay away from others when feeling even the slightest bit ill. Making that choice is choosing to keep yourself and others healthy. And in particular, because COVID-19 can be spread before you develop symptoms, it is essential that if you have been contacted by public health and been told that you are a contact of COVID-19, please stay at home for the full period recommended by public health. This is an extremely important way to protect people with whom you work, with whom you interact, and those in the community. So where we are today is that we all know what we need to do to protect ourselves and each other, and this is the time for us to be using all the layers of protection. We can all do our part by working together while staying apart. I'm asking you to please understand the risk and be an influencer and a champion. Be the person that supports your friends and family to do the right thing, and know that by doing so, you're helping to keep all of us safe. And I'd like to finish by thanking all of you for what you're already doing, because I know that British Columbians are working to protect their friends, their family, and their community every day. Thank you.